So today I had my HSG scan. Um, Wanted to just do a little video on my experience. um, Really, I worked myself up big time. So any advice to anyone out there that's about to get an HSG scan? I don't know how to pronounce the whole name of it, but doctors usually call it a HSG scan. Basically what it is, and I actually got pictures of it, and my husband was there with me, and he took a video of the whole thing, so you can see the dye actually going into my uterus and through the fallopian tubes. So yeah, I'll put that in the video, and so you guys can see that. And basically, yeah, I was a nervous wreck. Sorry, Penny's kind of in the video. Yeah, I was a nervous wreck. Big word of advice to anyone if you're watching this video. Maybe you're trying to look up stuff on the scan. Maybe you're about to do it. I just want to let you know that it's gonna make things a lot worse if you look up lots of stuff, because I went crazy the last few days and I was looking up all kinds of videos, YouTube videos on women that have gotten this test done, and there was lots of scary things that I saw. It scared me half to death, and I really regret looking at these videos and reading these reviews of these horrible experiences some of these women were having. So I, of course, after seeing everything, was petrified. I had it this morning, and my doctor prescribed me, the new fertility doctor that I'm seeing, she prescribed me antibiotics that I started taking yesterday, and then I take today, and then I take tomorrow, just in case of infection or anything like that. They want you to take that. And then I also was prescribed 600 milligrams of ibuprofen. So you want to take that an hour before the procedure, because you get crampy, and you want that just to make the pain or the uncomfortableness a little bit more tolerable, because there is some uncomfortableness. Definitely not as bad as I thought it was going to be, but there is definitely uncomfortable feelings that you will feel. So basically, I got in there this morning. They had me fill out some paperwork. I was a nervous wreck. I was on Xanax. I took a Xanax, and I took 800 milligram ibuprofen. My husband has 800 milligram because he has really bad knees and all kinds of pains in his body, so he's always had really strong ibuprofen. So I took the 800 milligram ibuprofen with a 1 milligram Xanax. So I was feeling pretty loopy and good, pretty much. But I still was nervous, even though I was on these drugs. I still was completely terrified this morning. So, I mean, I felt like I was going to throw up. I was shaky. I got in there, and the nurse was like, "It's okay. You're going to be fine." So she took me in the back, made me put on a gown. Then she took me into this really sterile, surgical looking room. Kind of scared me a little bit. I see this table I have to sit on. The table didn't have stirrups where you have to put your feet up. They just had you spread your legs open, and they have you move to the very end of the table, so your butt's right there at the end of the table. And the doctor came in, really nice older man, totally made me feel comfortable. The nurse made me feel comfortable. They knew I was nervous, so they were just reassuring me everything's going to be okay. And he said that, my husband was in there, and they had my husband go in this other little room off to the side where he could see the screen, and the nurse said, "Watch this, you'll be able to see the dye go into the uterus." And so he sat back. I didn't want him by me because I felt like I just was going to get too nervous with him there, because I don't want him to see me in any kind of pain, because I know that stresses him out kind of, so I didn't want that energy in the room. So he stayed back where I couldn't see him, in a separate room, and I can kind of see his head peeking through every once in a while, checking me out, seeing if I'm okay. But anyways, the beginning of the procedure, they take a speculum just like they do in a pap smear, where they spread you open. You know, we've all done it. We've all had pelvic exams. Easy. You know, not the best feeling in the world, but easy. So they spread you open with the little things. I don't know what they're called. But they spread you open, and then he's like, okay, you're going to feel a little pinch kind of feeling. You know when you get your pap smear and they kind of do a little sample with that little brush thing? You feel kind of a weird sensation. So he's like, you'll feel that kind of sensation because they're sticking the tube into the hole of where my uterus is. And it went in totally easy. I guess sometimes the hole is hard to get into. It's either really closed, really tight. Mine was totally easy. It went right in. I felt it barely. Totally easy. And then they put this x-ray thing over my body, and I had a screen up to my right, and they're like, okay, here's your pelvic. I couldn't see anything yet because the dye wasn't in me, and I'll show you the video right after this so you can see exactly how it went. And he was like, okay, we're gonna start putting the dye in. So I was bracing myself because I heard that this is the part that hurts when the dye starts going in. And so it started going in. I could see it filling up my uterus, slowly filling up. And then all of a sudden I start to see it going into my fallopian tubes. Only my right fallopian tube was filling up. So he's like, okay, it's not going through your left. And of course, as it got halfway up in my uterus, I started feeling very strong cramp feelings. Some women said it's very bad PMS cramps. Yes, it is, but it was a little more intense than that. And I had heard, and even my mom got it done, she's like, that's what contractions sort of feel like. I don't know if that's true. I've never had contractions. I've never given birth. But she said it's sort of that sensation. It's sort of that feeling. So yeah, it was intense. I started kind of freaking out a little bit. I was like, when I get nervous, I go like this with my hand and I kind of like squeeze. So I'm squeezing, I'm sitting there and I'm like breathing in and out. And then the nurse was like, it's okay. She had her hand right here, and I was like going like this to her hand because the cramps were pretty intense. It's just crampiness. That's all it is. That's the only bad part about it. We've all felt cramps. I've gotten pretty bad cramps for my periods. It's like that, but just a little bit more intense. That's all it is. And when they go through the fallopian tubes, you feel it more because it's a small space, and it's just, I think it's unblocking stuff. But my left fallopian tubes, it was blocked. Nothing really went through. Just the beginning of it, he said that there's definitely blockage. And they could have kept going. He could have kept putting dye in, but it was really intense for me, the feeling. So he's like, okay, we'll stop. One of your fallopian tubes is totally clear, totally fine. You can still get pregnant with this. So yeah, bummer that both of them didn't totally go through. You'll get to see in the video, but you know, at least one of them's good, and I'll just have to wait until my right ovary is ovulating. And since I'm seeing a fertility specialist, I'm sure they can tell me what one will be ovulating. So that's the news on that. Afterwards, it was a really quick procedure. The whole thing was probably no more than 5 minutes. It was really quick. And as soon as they took it out, and as soon as he stopped pressing the dye in, all the pain went away, normal. And they had me get up. They had me put a towel between my legs because they put dye in, so it's going to start coming out, which only looked like water. It didn't look like anything coming out of me. It wasn't like blue, like regular ink or anything like that. But they took me to the bathroom, and they gave me a big pad because, of course, it was going to start coming out. It's still coming out. And that was that. Easy peasy. The whole process was 15 minutes. Stepping into the office, getting changed, filling out some paperwork, the procedure. That's it. Easy. Trust me. If I had to do it again, I would do it. It's not that bad. I think a lot of women that had really bad experiences hadn't taken anything. They hadn't taken any ibuprofen. Even with ibuprofen, you felt it, but it wasn't bad. It really wasn't bad. It was tolerable. And hey, it's just one step closer to that baby. So I just look at it that way. So, yeah, that's how my test went today. I was very nervous, and I'm so happy it's over with, and I'm that step closer to starting all my medications. I talked to my nurse who works for my fertility doctor. She's the one that I talk to. Anytime I need to talk to her, she's on call for me 24/7. I'm supposed to let her know when I'm ovulating. I'm supposed to let her know any little detail of my cycle. So I can go in and get injections. I can go, she'll tell me when to start trying. She'll tell me when to come in and do an ultrasound to see if I'm ovulating. Any little thing at all, she's my nurse. So I called her today and told her that I got the HSG done. She's like, okay, well, I'll wait for the results to come in. I guess they're still waiting for the results of my husband's semen analysis. He did it a few weeks ago and it still hasn't come in, which is weird. But anyways, yeah. So she said once we get all that in, I already did my blood tests. She's going to look at everything today, and she's going to hopefully call me today or tomorrow's Saturday. So maybe she'll call me tomorrow. I don't know. But they're going to prescribe me with Clomid, which is going to make me ovulate and hopefully get pregnant. And I heard that after you get an HSG scan and you're trying and you're on like a drug like Clomid or whatever, you have a huge chance of getting pregnant because all your tubes are totally unclogged. Well, one of mine is. Hopefully it's my right ovary that's ovulating. But yeah, I guess you have a really huge chance. Even my next cycle, he said that dye just kind of cleans everything up and the eggs can get through good. And he said definitely try this month, and I'm only in day 7 of my cycle, so I'm early on, and since I'm so early on, they're going to start me on this medication. And you guys, hopefully something happens this month. I really, really hope so. Yeah, it's just, I have really high hopes. But if it doesn't happen, I have next month. So I can't stress. I can't worry about it too much. It's going to happen when it's meant to happen. So yes, I'm one step closer. I got that part out of the way. It was so hard. I was so scared, but it's done. So I'm so happy. Another thing that I got this PCOS diet plan book. I'm going to read this. It has all things I need to know about PCOS, how to eat, how to exercise, how to maintain this syndrome that I have, and hopefully get rid of it maybe and help it. So anyways, I'm going to end this video because I'm almost to 15 minutes, and I want to put the little video of my HSG scan that my husband recorded, and then I'll put a couple pictures on there too so you guys can see. But yeah, anyways, I will do another update soon after I talk with my doctor or my nurse and they get me going on a plan, and I'll let you guys know. So thanks for watching, guys, and I will give you another update soon. Bye.